Guten Tag, meine Damen und Herren. Good afternoon, ladies and gentlemen. So I'm going to do this presentation in English now. Unfortunately, one of our colleagues, Alexander Wunsche, couldn't make it today, so his topic today was going to be the ReBourke bar. So I'm going to talk about the ReBourke bar for you today, and just a quick video to start the presentation off, a little video on just what the ReBourke concept is all about. Okay, so before we start the video, so we have a lot of patients who are challenged in hygiene but want great aesthetics, and this is a challenge we always have to face, is where we have the compromise between hygiene and aesthetics. And as we know, most patients pay money to have a fixed restorative restoration, but we're always challenged with that hygiene component of it. So we do have a very, very great solution. It's a solution in the name of ReBourke, a concept designed by ReBourke out in California. And it's an amazing solution for the challenges that we face for these type of patients. So just a quick video. Okay, that's my presentation. Okay, this is no normal double structure bar. So the concept is quite simple actually, but is simple in its makeup, but really resolves a really, really complex situation. So what it is the primary bar is made up of certain components, but if you look in the anterior, we have a 25-degree angulation to prevent any rotation in the double structure. So what we do is we try and keep that occlusal plane stable. And with this 25-degree angle, if you can imagine, when the double structure tries to tip, that 25-degree angle prevents it from moving and keeps it in a stable occlusal plane. And this whole system of the 25-degree angulation together with MK1 attachments, I don't know if any of you are familiar with the MK1 attachments, been around for almost 40 years already. It's a great attachment, but we have two MK1 attachments placed in the posterior of the implant bar, and what this does is it locks through the 25-degree angulation in the front, and then we lock the posterior in with the MK1 attachments. The beauty of this concept is that we have no wearing parts on our bar. Everything is fixed because there's no nylon. There are no wearing parts on this restoration. So as I explained, we have in the posterior, we have the MK1 attachments, which are fixed into the double structure of our bar. And sorry, I'm trying to go between the German and the English. This really gives, this whole concept gives the patient the feeling of a fixed restoration. So again, from the hygiene perspective, when the denture is in the mouth, the MK1 attachments are locked in and the denture is fixed in place, but with the help of a little key and in the buccal side of the acrylic, we make little grooves and we can dislocate the MK1 attachments. And here you can see it. So it's conceptualized in the sense that the double structure is slightly tissue compressed, so we have a seal around the tissue. And why is that important? This is a case that we did about 4 years ago, and as you can see in the top left-hand picture, the bar looks great. It's a bar on locators, and from a occlusal perspective, everything looks beautiful. It's shiny, it's clean, patient is very diligent and always clean the denture. As soon as the denturist, this is a case from Canada, and as you can see, once the bar was removed, as much as this patient tried to keep everything clean on an occlusal concept, the underside of it was really not that great, right? So nothing the patient could do. It is just the way that it worked. Bacteria got in underneath the denture, the bar. So once we replaced this whole concept with the ReBourke bar, we put in a new bar, we did a reconstruction, and what we do is we put a little palatal seal. There's a little bit of tissue compression so no bacteria gets in underneath. So we've eliminated this buildup of bacteria underneath the bar. So the double structure, slight compression. And this patient, after 4 years, still has no buildup. I saw this denturist not too long ago, and the same patient still has a totally clean bar on the intaglio. So a great solution for patients who have oral hygiene issues but would like something removable. The space dimension requirements, we're looking in the region of about 6 millimeters. So the MK1 attachment takes 4, and then the double structure comes. So at 6 millimeters, you're still well within a very low profile bar, so it does accommodate most, if not all of your patients. The double structure, as all our double structure components as well, we create twofold. We have the attachment elements, but we also create almost like a telescopic effect. So we have a bit of a friction element. We create stability, lateral stability, and also a little bit more retention in a vertical. So you'll see the friction is guaranteed by the two components fitting very well together. We also have a few options within the double structure, so it really just to accommodate all your needs. So on the lingual band, lingual lip, what we try and do is we try and eliminate any material in the palatal area. Obviously, we want to create as much tongue space as possible. And by creating the lingual lip and the lingual band, we create a bit of a finishing line. So you will see I have a model right here, somewhere there. And you can have a look at it once we're done with the presentation. But you'll see there's a definite finishing line all the way in the palatal area. We also have mesh extensions. So mesh extensions are used when we need to go further back in the palate, but we don't have enough the cantilever. We don't want to go. The AP spread is too small, so we can add a mesh extension to extend that, not on the bar, but on the double structure. So that's the purpose of the mesh extension. And Montreal upper, it's just an upper extra retentive element if you want to get extra retention on your double structure. So these are added options, but used together or individually. So they're all available on the double structure. And then just a quick review of everything. Here you can see everything in place. We have our MK1 attachments, we have our retention, posterior retention, and then a Montreal upper retention. So this is a combination of all of them together. And then, of course, on our double structures, we will do what's called a silicoating. Twofold purpose. Number one is to mask or opaque the double structure so you don't have that gray hue coming through your acrylic. And secondly, to add a bit of a chemical bond between the titanium and your acrylic. And here you can see the composite opaque on the double structure together with your retention and your Montreal upper for retention. This is a case. This case was done by Mark Williamson. He was the first winner of the Panthera Master Cup in 2017, and the project was a ReBourke upper. So just to show you the buckle aspect of where the access holes are for the MK1 attachments, we put little holes into the buckle of the teeth. They may come out of the teeth or the acrylic, but they're tiny little holes just to accept the key to dislodge the MK1 attachments. What we do a bit of a funnel of form so that the patient can guide the key into the hole. But as you can see, it's a very small hole. It doesn't affect aesthetics, and very, very easily blends into the whole restoration. On the lingual, what we do is once everything's finished, here you can see the lingual lip that we've created. So we've kept a nice open palate we've created a nice palatal seal. So as I mentioned earlier, we try and create that palatal seal so that nothing gets in underneath the denture. And on the lingual, we cut back the screws, the keys for the MK1s. Everything is polished flat, and now for the patient, it's nice and smooth. And just a frontal view of the whole case. You can just see very much in the back here, and over here are the MK1 holes, but they're not in the aesthetic zone, so really not an issue. And thank you very much for your attention, and if you have any questions, please see me or one of my colleagues. We'll be happy to address any of your concerns or questions. And yeah, I hope this was interesting for you. Thank you.